How can you prepare for a smoother birth? Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. This is Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. I see a lot of pregnant and postpartum moms in my physical therapy practice, and I want to share some information today to help you if you're currently pregnant, planning to get pregnant, or you're here just out of curiosity. So I want to talk about the three things that I typically check with my pregnant mamas in order to help them have a smoother pregnancy and also prepare them for a smoother birth. The first thing that I look at is mobility through the pelvis. So there's certain positions that this pelvis needs to go through in order to have a vaginal birth. And even if someone does end up having a C-section, depends on how far baby is able to get down into this pelvic inlet. And there's reasons, for C-section that I'm not going to go into for this video. But basically what I look at is mobility through the bony pelvis. So imagine if you were to put your hands on your hips, they would land right here at this pelvis. So there's a lot of flexibility in here, and the pelvic bones and the sacrum from the backside need to move enough and adequately in order to allow baby to engage in this pelvic inlet and then to be able to come on out the other side. Okay, so there's a lot of mobility through here, the pubic bones as well as these pelvic bones and the sacrum, to check during pregnancy to help moms be more comfortable during pregnancy, and also to alleviate pain and prepare for the mobility that needs to happen in order to have a baby. The second thing that I check is uterine mobility. So imagine this balloon is your pregnant belly. Now, I got this idea from Lynn Schulte at the Institute for Birth Healing, my mentor. And so this clever idea of using ribbons and tape to represent the three sets of the uterine ligaments was her idea. So I'm borrowing that because I think it's a great visual. So we have the round ligaments here in the front attaching, and they actually come down into the front of the hips here into this inguinal canal, and they attach onto the labia. Okay, and I'll show you that here in just a bit. Then we have the broad ligaments. We have one on either side, and they come in and they attach onto the really thick peritoneum into the inner hip here. And then we have from the back side, we have these ligaments coming and they attach onto the sacrum or that tailbone. So if I put this balloon into this bony part here, hopefully you can see this a little bit better. So we have the round ligaments coming from the front and they come down and they attach, like I said, onto the labia. Then we have the broad ligaments which come into and attach onto the sides here. And then we have the back side coming, dipping down in and attaching onto the kind of the lower part of the sacrum here. So imagine that this balloon being the uterus and growing with baby, imagine that these ligaments are kind of like guy wires. So if this were like a balloon, a big Thanksgiving Day balloon in the air, and you have 6 people holding on to these ties or these guy wires onto that balloon, can you imagine if, say, one of those guys are pulling a little too hard? Okay, they're a little tighter than the others. And how that's going to impact the alignment, or rather the balance of the uterus. And imagine that there's more than one that's tight, and how that can really cause some rotation and maybe side bending and pulling forward, and how that might, depending on where they're attached to then, how that could cause some discomfort. And also really important to be thinking about is how that's going to change baby's position, not only in mama's tummy, but how baby is then entering into that pelvic inlet, whether they're coming down straight or whether they're coming in at an angle. So while the uterine ligaments aren't the only thing that's going to impact that, it is one thing that we look at, and we want to make sure that we're balancing things that are not quite symmetrical or balanced. The third thing that I check with my pregnant mamas when we're preparing for a smoother birth is the birth door or the pelvic floor muscles. So here with this pelvic model that I have, If I just flip it up, this would be like if you were a woman and you were lying on your back. You can see the vaginal opening, we see the rectum down there, we see the urethra there, and we have pelvic muscles here, these superficial muscles that are close to the surface of the skin. We can see the deeper pelvic floor muscles here. And if we were to dip this forward and look underneath the organs, we could also see the deeper pelvic floor muscles. So during pregnancy, the later stages, we can feel into these muscles either from the outside or going intravaginally into the vagina, basically. And we can feel these muscles to see if they are balanced, or is there one side that's tighter, there's one side that's more active. We want to work on that so that we have even opening of these pelvic floor muscles as baby starts to head down through and come on out to that pelvic outlet. So the muscles that are most affected during pregnancy are these coccygeus muscles, clear back here in the back. We can see those also from the back side here, and the levator ani muscles, which are all of these muscles in through here, and we can see them also from underneath. So those muscles need to be able to lengthen out and allow baby to pass on through here. So it's beyond looking at, say, the mobility of the perineum. That's right here at the, right here in the front here. While that does need to stretch, it's not the primary thing or the only thing that needs to be stretching. So we definitely look at pelvic floor mobility and balance. So that can help moms have that smoother delivery as well. Along with that, I also like to work with my moms on just helping them to be more aware and more empowered into this area, especially for the moms that say have had some kind of injuries, whether that be sports injuries or whether they've had some trauma, or they just feel disconnected to this area. That's going to really impact the birthing process if mom is feeling disconnected from this area. It's going to really impact how well she's able to push, how comfortable she feels in her body, as well as how confident she feels in her ability to have a vaginal birth. So those are also some things that I work on as well, along with the three major things that I already mentioned. So with those three major things that I look at, you may be wondering now, okay, now what do we actually do? What does it look like in the treatment room? What do you do, Justine? So one of the things that I do is once we get that baseline information of what's going on with your body, what might be imbalanced, what's not moving, and what might be an issue, I use my hands to help kind of nudge those areas and release ligaments, help to release pelvic floor muscles, and just do some manual work very gently for you. And it's also gentle for baby in order to get things moving and get things balanced. So manual work. Another thing that I do with my pregnant moms is we work on breath work. So different types of breathing in order to help during labor and delivery, and also other tips. So for instance, let's say you have persistent pain and we've been able to relieve that, but it keeps coming back and we're worried that that might be an issue during labor. It might impact what positions you can get into, or it may impact your ability to kind of stay present during that birthing process. So there may be tips on, hey, these positions or this particular strategy can help you to alleviate your pain during birth. Okay. And I'm more than happy to talk to your doula or your midwife as well if you would like me to do that on your behalf. Another thing that I do with my moms is help them practice pushing. So around 38 weeks, we actually practice pushing so that moms can be aware of how to actually do that. Sometimes when I ask people to push, they're actually doing a contraction and they're doing a Kegel, when that's going to keep baby in instead of relaxing the pelvic floor and letting baby come on out. And we practice in different positions. That way mom knows and feels empowered on what's the best position for her to push in. And then the last thing that I like to work on with my mamas is just some energetic work. So working with the energetic pelvic bowl. And that's a little more, it's a little harder for me to explain that, but just intuitively helping moms guide in to see what they're sensing, what might be holding them back during, the later stages, and allowing baby to get into position where they need to, or what's coming up for them as far as how they feel about being a mom, and what might be lingering in, their just energetically that might impact their birth. So if you are currently pregnant or you're planning to become pregnant and this resonates with you and you're thinking, wow, I really want to make sure that I have a smooth birth and a smooth pregnancy, please reach out. Go to our website, healingspotpt.com. That's the best place to get started. Fill out a form on our website. I'd love to sit down and do a discovery session with you and get all of your questions answered. Thank you for watching this Ed Talk.